Hello, you're welcome to the Pentagon Clinic show. Thanks for joining us today. We are on a series for palliative care, and today's topic is childhood cancer. Meanwhile, my name is Dr. Shine Phoebe Alex, and I'm your host for today. We'll be talking on childhood cancers, and I'd like to let you know that children within the ages of 0 to 14 can come down with cancer. And also adolescents between the ages of 14 to 19 can also come down with cancer. Now, types of cancers. We have leukemias, which are the bone marrow cancers. We have the brain and the spinal cord tumors. We have what we call neuroblastoma, which is the nerve system cancer. We also have what we call Wilms tumor, which is the cancer of the kidney. We also have lymphomas, which is cancer of the lymph node. And this cancer, there are two types, which is Hodgkin lymphoma and non-Hodgkin's lymphoma. We have rhabdomyosarcomas, cancer of the myocytes. We also have retinoblastoma, the retina of the eye, the cancer of that particular part of the eye. And then we also have the cancer osteosarcoma, that's the cancer of the bone, and so many other cancers of so many of the organs of the body. Risk factors of childhood cancers. What I mean by risk factors is what predisposes a child to having cancer. Number one is family and genetic history. That carries about 5 to 15%, meaning that if any family member has a form of cancer, there's a tendency that along the line, a child may come down with cancer. And then number two is parental exposure to radiations, to x-rays, excessive use of x-rays, tobacco products, and some certain drugs. And then number three, which has the percentage of 75 to 90%, are definitely unknown. We'll talk about the signs and symptoms of cancer. That is to say, what you see in a child and you begin to suspect that this may likely be a cancer. Number one is a lump and swelling. Number two is easy bruising and bleeding. Number three, unexpected paleness and loss of energy. Number four, an ongoing pain in any area of the body. Number five, an unexplained fever or illness that doesn't go away. Number six, frequent headaches and vomiting. Number seven, the child just suddenly does not see again. Then number eight, sudden weight loss. You suddenly discover your child is losing weight without any definite cause. When you see all of these 8 signs and symptoms, or if you see all of this, if you see 1, 2, 3, you need to take the child to the hospital for urgent screening. Now, the treatments of these cancers are majorly just three standard treatments. We have chemotherapy, radiotherapy, and surgical removal of those organs that are cancerous. And then above all, palliative treatments for pain management and holistical treatment of the cancer itself. Now, for a child going through chemotherapy, radiotherapy, there's usually this side effect that affects the child's brain. and makes the child slow to learn. And when a child is under this treatment, you have to help a child, give the child an assisted learning process. Maybe the child may not be able to cope with his or her original class. What you do is you get a teacher to teach the child from home. It's not that the child is dull, but the treatment the child is receiving is giving this child an after effect on the brain and making the learning process slow down. So this is part of palliative care, which we want you as a parent to know. So when your child is suddenly not coping with school activities, do not say the child is dull. Just know that the chemotherapy and the radiotherapy the child is receiving is contributing to the child's cognition and learning speed. So that is a form of palliative care for the child. And then do not forget, other pain managements have to follow suit. Just like in our previous lecture, we've taught you on how to manage pain in palliative care. That is the same processes you have to follow. But moreover, the good news is 70% of childhood cancers are curable. Just if you get to do the screening early and discover what type of cancer it is. Now, we are here. The Pentagon Clinic Show is here for you. We are here to support you through the journey of treating this cancer and winning. We are also here to support you get the best medical therapy with the best consultants. The oncologist in our team is a worldwide recognized oncologist. If you partner with us, if you join us to fight this, rest assured that whatever you have as a challenge, whatever cancer that you have on your table will be dealt with in the shortest possible time. Right now, I'll oblige you to subscribe to our YouTube channel, follow the series of the Pentagon Clinic Show, and do well to call us on our line while we pray for God to do the rest. For now, God bless you all.